Support for NPR comes from Strawberry.me, whose career coaches offer professional support to help people get unstuck, gain clarity, and move forward, whether advancing in a current role or choosing a new direction altogether. More at strawberry.me/public.
You're listening to 88.5 NEPM, NPR News and Local Perspective for Western Mass. The Rundown with Carrie Saldo is funded in part by Armbrook Village.
This is The Rundown, your weekly news and review from Western Mass. I'm Carrie Saldo. Good morning. It's Friday, March 13th, 2026. Another Friday the 13th in 2026. Our rundowners this week: Greg Sukiennik, news editor at the Berkshire Eagle; Eric Lesser, senior counsel at WilmerHale and a former state senator from the 413; and joining us soon, Aprell May Munford from the Springfield Republican. Good morning, everyone.
Good morning.
Good morning.
If you at home have thoughts, email therundown@nepm.org. That's therundown@nepm.org. Coming up later in the show, the only state budget hearing in Western Mass was held this week. What do those hearings accomplish? We'll dig into that. Plus, efforts to bolster women's health in the 413 and an investigation reveals the extent of Legionella at Berkshire Medical Center. But first, we were off for 2 weeks and now we're back, and the U.S. and Israel went to war with Iran. The war with Iran entered its 14th day today. NPR reported yesterday, quote, Iran issued what it said was the first message from its supreme leader as attacks on commercial ships spread to Iraq's waters, and oil prices climbed back above $100 a barrel. In an official statement purported to be from Iran's new supreme leader, Mojtaba Khomeini, still learning how to pronounce that name, Iran vowed to keep the Strait of Hormuz closed and keep up attacks on U.S. bases in the region. Karine Jeary spoke with Massachusetts Congressional District Representative Richard Neal this week. Here's part of what Congressman Neal had to say about the war in Iran.
Generally, wars that America engages in become fairly popular at the outset, and at other times the support begins to wane if there's not an immediate objective and accomplishment. In this particular instance, the American people overwhelmingly have been against this from day one, largely because there has been no stated national or international purpose. No
stated national or international purpose. Eric Lesser, your thoughts?
Slow news week, right,
yeah,
Carrie?
Slow news. Slow news.
So the stated purpose, of course, is to prevent Iran from acquiring nuclear weapons, and we'll see where this all goes. I think it's worth noting that there's a lot of connectivity between Western Massachusetts and this war, which might not be apparent at first blush. One thing I just want to give some attention to is we have Westover Air Base here in Western Mass. The C-5s are participating in the airlift operations, bringing material and support to our troops in the Middle East. So there's a lot of people connected to this. We also have a large, Middle Eastern community in Western Mass, yes. Large Israeli population, a lot of people from Lebanon, and we have an Iranian population as well. So there's a lot of people impacted here. We'll see where it all goes. For now, we just want to make sure that our men and women who are over there are, staying safe and are staying supported.
Yeah, Congressman Neal pointed out that a few things were missed in the lead up to the war against Iran: a national conversation about priorities, a national conversation about realities, and a stated purpose of why it was needed and a timeline for the conflict. Congressman Neal, again, speaking to Karine Jeary this week. The Berkshire Eagle looked at gas prices. A little person on the street reporting there and talked about the impact that residents are feeling as prices have increased and continuing to do so. Gas prices up 40 cents in 1 week in Massachusetts. The average price of a gallon of regular gasoline, $3.31 a gallon, and I had to check because I now drive an electric car. But that does not change the fact that a lot of people do drive gas cars, and there was a big impact that people are feeling. Greg, what did they tell Izzy Briers?
They told Izzy they were, they also told Izzy, they were concerned about home heating oil. We've already been through fake spring, and we're back into March now. So, there's at least probably one delivery coming for most folks, and that's going to jump up by three figures. So looking at $600, $700, $800. I mean, and for people who are already stretched, and for whom inflation has already been and the lack of rising wages to go along with it has already been an issue. That's a big deal. And on top of it, the folks Izzy talked to, by and large, don't see aren't seeing the rationale for this action.
Now, gas increases during a time of war. Nothing new, nothing unusual there. We saw it several years ago when Russia and Ukraine started that war. Gas prices went to $5 a gallon. There is, some speculation that we'll see that again. California is already seeing gas at $5 a gallon. Aprell May Munford, good morning. Welcome. Thanks for being here. The New York Times reported this week that so far polls have found that most Americans oppose the Iran attacks. Support ranges from 27% in a Reuters Ipsos poll to 50% in a Fox News poll. Brooke Hauser, a Western Mass reporter who worked for the Boston Globe, spoke with 4 Iranian students studying in the U.S., and they reported to her a range of emotions. Many Iranians are supporting the military intervention. One particular student, a kinesiology student at UMass Amherst, Pardis, said she came here because she couldn't see a bright future in Iran. She's grateful to the Trump administration for intervening and killing the Ayatollah Ali Khamenei, the former supreme leader. Quote, "No one other than Donald Trump would do that for Iranians," she said. Aprell, as you're watching all of this unfold, what's on your mind relative to the joint action happening with Israel and the U.S. against Iran right now?
The human casualties. The human casualties.
Yeah.
I think we've seen enough death.
Before 1979, the year of the hostage crisis, Iranians made up the largest proportion of international students in the United States, Brooke Hauser reported, around 50,000. And currently, we have about 11,546 active records for Iranian international students in the U.S., attributing the recent enrollment decline to Trump administration travel bans. So interesting connection that Brooke Hauser helped to make there. Any final thoughts on this morning?
Yeah, I thought it was a really good piece by Brooke, who's based in Western Mass. And one of the things that I thought was most interesting about that is it was maybe a little bit surprising to people who have not been immersed in the geopolitics of this, that the Iranian American or the Iranian students who are from the country, still have family in the country, and have the closest connections to the country, seemed to be the biggest supporters of the president's actions, which I think says a lot about the nature of the regime and how unpopular it is with people who live there. So we'll see where this all goes. The oil prices are something to keep an eye on. They spiked, I think, to over $120 a barrel briefly earlier this week. Last I checked, it's a moving target, but it's hovering at around 100, a little bit under 100. That's kind of the magic number. If it stays under 100, I think that the public will give this some time. But if it starts to spike above that, you're going to see some real impacts on the economy.
Aprell May Munford.
What I saw someone say was that although it took them a lot to fill up their tank, they invested in gas stocks, and that's offset.
So they're making up the difference there.
Yeah.
Well, that's what the president said, right?
Yeah, right. The president spoke at length this week about this. He has vacillated sort of in his expectations around the length of time that we're expected to be there. At some points, he's called this a short-term excursion. Other times, he said unclear what the timetable is there. So we will continue, obviously, to watch this unfold. Moving on, lawmakers examine railroads during marathon budget hearing at UMass. That was a headline in this week's Daily Hampshire Gazette. The West-East Rail Planning, Chapter 90 road funding, a host of other issues were discussed at the only Western Mass gathering to discuss the governor's budget. And, Scott Merzbach wasn't kidding that it was marathon. 6 hours this hearing Tuesday at the University of Massachusetts Amherst. Eric, you just, start speaking from experience as a former state senator sitting at different budget hearings. Give us sort of some behind the scenes in terms of the impact or the effectiveness of a hearing such as this. What difference is it actually going to make as we look at, a $63.36 billion proposed budget that is still being debated ahead of the July 1st fiscal year start.
Yeah, so first, shout out to Senator Jo Comerford, who hosted the hearing, brought everybody out. She is vice chair of the Ways and Means Committee in the Senate. That's a very important role, and she's leveraging that very effectively by bringing all of these officials to Western Mass. For a little bit of context, this is the budget season when the Ways and Means Committee does a series of hearings on different topics. So the one that just happened in Western Mass was transportation related. There's ones on healthcare, on education, on public safety, on the various kind of categories of spending that the state has, and it's fairly straightforward. The hearings involve the agencies coming, making their pitch, making their proposals for what they want to do for the year. The members of the committee, the senators and the representatives, get a chance to kind of ask questions and put their own perspective forward, and then it culminates in the budget, which is approved in April in the House and in May in the Senate.
Hopefully.
And then finally, the whole process is supposed to finish by July 1, which is the end of our fiscal year.
I didn't pull the stats on the last time we've had an on-time budget.
Yeah,
so
most years that gets kicked a little bit farther into the summer. But the point is that this is really the dress rehearsal for the ultimate votes and the ultimate kind of back and forth that will happen a little bit later into the spring. And it's a good signal of where the state is going in terms of priorities and spending.
Some of the priorities that were brought up, not surprisingly, West-East Rail, East-West Rail, wherever your money rides on that one. PFAS came up and protections around the Quabbin Reservoir. We've talked about that a bunch here on the show, and whether or not people living around the Quabbin should have access to that water, while many of their wells are contaminated with PFAS and they're not accessible. They don't have access to that drinking water in the Quabbin. Greg, as you're watching yet another budget season as a reporter, what stands out for you here?
Boy, I wish they'd come to the Berkshires, see our, take in the Berkshires are a renowned tourism destination, and they could have come and taken in our crumbling bridges and talked to school districts about how they're going to have to lay off teachers and staff, and seen, those would be the two things that come to mind about, hey, we're still out here. We've still got needs.
It was interesting to me to see that something that didn't come up, and maybe it did come up at the hearing and just didn't make the cut for print, but there's the new $75 million accelerated bridge repair program that the governor has launched, and it's supposed to help 27 bridges in Western Massachusetts. I thought maybe that would have gotten more airing at a hearing like this.
Maybe no one wants to talk about it, just in case someone says, well, wait a minute, why are we spending that much money on bridges? It's like,
in Western Massachusetts?
Yeah, just step back. We're fine. We're here. Just help us get from, across
just
the
keep it
Hoosic
quiet,
River.
Nothing to see here. We're going to send some bridge money out
but it's going to take a slight detour.
Yeah. And another area of the budget, education, NEPM's Jill Kaufman reported on some education advocacy work this week. A group of rural educators and elected officials calling for funding for equity in rural schools. We have a lot of those here in Western Massachusetts. They're calling on the state to fully fund rural school aid to the tune of $60 million, while also demanding that the state pass policy recommendations from 2022. Provisions that would help both rural schools and school districts and chronically declining enrollment. Greg wants to say
I talked to a bunch of kids who were writing letters yesterday. 8th graders at Clarksburg School, just in Clarksburg, just north of North Adams, were writing letters to the governor, the lieutenant governor, the chair of the Ways and Means Committee, about the importance of rural schools, about how they're the center of community, about how they're major employers, and about the reasons that aid is important to them because they rely upon a residential tax base rather than commercial taxpayers. So fairly sophisticated, and they were writing letters, making signs. And I understand that this has been a drive all week for this. There was, I think, Shelburne Buckland and Hampshire Regional also actually sent kids to the State House to testify. So
yeah, it's been a week long.
So they're getting active and and getting engaged. And it just so happens that this is like the same time that they're doing their civics, their civics unit in history. So what a surprise.
Eric Lesser had a hand in beefing up civics education across Massachusetts. So the Legislative Commission on Fiscal Health for Rural Schools found back in 2022 that it costs 23% more per student to provide basic education in small rural districts than in a district with more students. Aprell, as you're watching this, what are you thinking?
I mean, I go back to my conversations with Amherst Pelham Regional School District and how they said it's really difficult to bring all of these communities together and decide on a single budget. I've covered districts like Holyoke and Springfield where it's just one like city going after like what they want in their budget, but this is several towns that need several and maybe different things, and so them having to compete for the money or we see it. It's,
prioritize.
Yeah, it's just I can't imagine. It's really hard.
Yeah, Eric Lesser.
The other thing that I think has animated this hearing and will animate the budget season this year is the decision makers and the policymakers are juggling an immense amount of uncertainty. You know, perhaps more uncertainty in the state budget than has existed in a very long time. Just to back up and kind of remind everybody of where we are. You know, the Fair Share Amendment passed several years ago. That's now kind of fully online. But it's come in the context of, massive inflation across the board, especially in construction, civil engineering. Things like roads, bridges are much more expensive now than they used to be. You now have about to come online massive cuts to Medicaid and state support for health care as a result of the One Big Beautiful Bill, that passed last year. You also have some ballot questions coming up that could have huge consequences for state finances, including one that would cut the state income tax from 5% to 4%. We'll see where all of this shakes out. You also have as a backdrop the continued economic challenges both in Western Mass and now in Eastern Mass. You see stats about a quarter of commercial real estate is now vacant in the Metro Boston market. You see increasing competition with places like Florida and Texas for some of these high-tech workers. So there's a lot of uncertainty in the picture. For now, the state's fiscal picture is strong, relatively speaking, but there are a lot of question marks about where we're going to go in the next few years. And I empathize with these budget writers because they're balancing a lot of different forces. And I think in that context, it's really important for them to zero in on what's most important: the infrastructure, the education, the pieces of the budget that really make Massachusetts unique in a national setting.
We'll keep following that here on The Rundown. Still ahead, we're going to dig into two different healthcare-related stories. If you have thoughts, email therundown@nepm.org. Stay with us. You're listening to The Rundown on 88.5 NEPM. I'm Carrie Saldo. We'll be right back. Welcome back to The Rundown here on 88.5 NEPM. I'm Carrie Saldo, joined by journalists Craig Sukiennik and Aprell May Munford and former State Senator Eric Lesser. Lucinda's House expands maternal health work in Western Mass. That was a headline on some recent reporting by you, Aprell. Before we get into the details of the planned expansion here, give us a little context for what Lucinda's House does.
Lucinda's House is designed as a community-rooted maternal health and wellness space that centers on the care for Black women and other women of color. And it creates environments where women of color feel safe, supported, and celebrated. And it aims to address structural inequalities through community-led solutions.
And we can get into some of the statistics on those inequalities. They're staggering. But with the planned expansion, what is that exactly going to entail?
So she's going to hold like a lot of community conversations to actually hear what mothers and families need. It's really about connecting them to the care that they feel like they deserve, but also trusting women to know that they know what they need, right? And it's not us or them telling them what they need. It's getting what they need and then providing that for them.
The expansion now, I imagine this is not coincidental with what's happening at Mercy, where they're temporarily pulling back on some of their women's health. Is she doing this to sort of step up and fill a gap that she foresees in women's health, or why?
She's doing it to step up and fill that gap, but this is a passion that she's had for a long time. She spoke about how a lot of our families come from this sort of background where there was midwifery before there was nurses. And this is like a practice that, like, became professional, and then now it's like declassified as unprofessionalism. So she's holding these pop-up clinics, but she's also supporting other students who need midwifery support to get through some of those courses, and she's also supporting doulas.
You alluded a moment ago to some of the disparities that women of color face. Nationally, according to KFF, a health policy research organization, large racial disparities in maternal and infant health outcomes persist. I mean, this is going back, I remember 15 years ago when I was in a newsroom in Denver and they were investigating this issue. Pregnancy-related mortality rates among Black women are over 3 times higher than the rate for white women. That's 49.4% versus 14.9 per 100,000 women. I mean, that is just unacceptable in the day and age that we live in with the access that we have to healthcare.
Unfortunately, this story touches my heart so much because I could have been one of those women.
Yeah.
In 2021, I had a really bad miscarriage, and I don't feel like I had adequate care. I don't, and I went to, but anyways, so she's doing all these studies, she's doing all these researches, she's leading research proposals on preeclampsia, things that affect women. She's seeing not only like the symptoms, and she said there may be some symptoms that are not associated with it, but when they mention those symptoms, how far or how many days it is before they get the care, or if it's adequate care, how far do they live from the hospital, how much care do they receive. So it's just she's investigating early symptoms, treatment delays, and just studying levels of barriers.
Eric, as you're reading this reporting, what are you thinking?
Well, first, very, very powerful reporting, and it's a very big issue. Again, from the policy context, there has been an undeniable, closure and reduction in services in our region, in particular in some of the most vulnerable and highest risk communities. Holyoke lost its maternal health access several years ago. The Mercy maternal labor and delivery rollback is significant. And when this happens, you're reducing community exposure and access points for people to get the health care that they need. So, anything that we can do to shine a light on this is important. And, the policymakers, back to connecting, the earlier conversation about the budget, need to put more resources into Western Mass, and in particular into our communities in Holyoke and Springfield that have seen actually a closure of maternal health services at a time when we need it more than ever.
Yeah. Aprell.
One thing I could say is that when you look for services as a maternal
someone in need.
Yeah, as a birthing person, there's a lot of services in Eastern Mass. There's not a lot of services in Western Mass. I struggled to find places that I could get support.
Yeah, well, that is something you'll keep reporting on. We'll keep talking about here on the Rundown.
Can I just say one really quick thing? I love the lead that you wrote about Lucinda Canty. You have that first sentence. Lucinda Canty says she has no time for foolishness. You know immediately what she's all about. And as you dig into to this really important subject matter, it just really, it's
She's
great.
getting down to business.
It's great stuff.
Yeah. All right. So, Greg, I want to talk about a recent investigation that you did for the Berkshire Eagle. It shows that Berkshire Medical Center had episodes of, quote, uncontrolled growth of Legionella bacteria in recent years. We discussed this initial reporting here on the Rundown back in October. Now, before we kind of get into the latest, give us just the Instagram Reels summation of Legionella.
Okay, Legionella is a naturally occurring bacteria you find in water. It can't hurt you just ingesting it, but when it's aerosolized, that is from a cooling tower or a shower nozzle, if you breathe it in, if you're susceptible, it can cause Legionnaire's disease, which is an aggressive form of pneumonia. It's particularly dangerous for people in healthcare situations because those are people with underlying conditions
yeah.
And decreased immunity. And this is a case where the hospital had 2 deaths that were connected to Legionnaire's disease. And then DPH stepped in and said, because they were both seen within 14 days of their, because they had come back with symptoms between 14 days of having first visited the hospital, it was considered a healthcare cases, and so they step in.
And the Eagle really dug into the data here and looked at when and why, or when the reporting happened from the hospital and specific numbers. In reviewing the data as far back as 2023, you reported that test results showed Legionella growth in one of the hospital's cooling towers 170 times higher than what the Centers for Disease Control and Prevention considers under control. The data also shows that Legionella reached uncontrolled growth standards throughout its campus water system. The State Department of Public Health, the DPH, described this as symptom-wide. Now, BMC spokesman Mike Leary told the Eagle that the last round of testing showed, quote, no detectable levels of Legionella, and the hospital says it's on its website that there's no proof that Legionnaires was contracted by patients while in BMC care. So, Greg, for the DPH's money, is this like situation under control, nothing to see here, let's move on, or what happens?
They're still working with BMC. We've obtained emails showing that the back and forth is still going on with regards to all the ways that you have to try to control Legionella growth. It's tricky because there's a number of different factors. There's temperature. You have to make sure that the hot water is hot enough to kill these little beasties. You also have to make sure the water isn't stagnant, that it's not sitting around. That's a big problem in cooling towers, and that's the reason why cooling towers are often a vector for the growth of Legionella, because it's warm and water is moving around. And there's stagnant water at the bottom of the tower, and the temperature leads to growth, and that's actually where the disease got its name, from a cooling tower caused the infection in 1976 at a American Legion convention in Philadelphia.
And became Legionnaires.
Right.
Now, you reported in most situations 0 is not an achievable target for evaluating whether Legionella has effectively been controlled. Because of its potential to cause serious illness and death, healthcare facilities are advised to use kind of several best practices. Aprell, you had shared with me that you've been sort of in and out of hospitals recently with family members. When you read this story, what do you think?
Ew. Ew.
Yeah.
And I do recall working on a story about the healthcare grades, and I seen that several places in urban areas didn't get a good grade, and other ones in in rural areas got a good grade. And I've been to hospitals from Boston to Hartford, and it just seems like maybe staff is overworked and underpaid, because it could be cleaner. It could be cleaner. There could be more attention paid. Just for the record, my mom is in Bay State now, and she says her cleaning person is great. But I think that things like this shouldn't go under the radar.
Frankly, it's shocking to hear this, especially after so much focus was put on HVAC systems and air purifications after COVID. The hospitals received huge amounts of money for those capital improvements, and it's just frankly unacceptable. They've got to do better to keep the air clean. No one's saying it has to be perfect. I think that's acknowledged, but the levels should certainly be within the target benchmarks for what would be safe and healthy, both for the patients and also for the staff that's expected to be there every day.
Just briefly wrap
One
us
thing
up
I
here,
want to
Greg.
look forward to really quickly is New York State has a cooling tower registry. It's the only state that does. So we're going to be looking at that moving forward.
And you can check out the Berkshire Eagle's deep dive on this issue, eatberkshireeagle.com, and available later today on our website, nepm.org/the rundown. I am going to move us very quickly to a rapid-fire round of scoop, praise, and prediction, where you kind of tell us what's on your mind this morning. Greg Sukiennik.
I want to give my praise to those Clarksburg 8th graders who were writing their lawmakers about rural health aid. Way to be involved.
Absolutely. Eric Lesser.
I'm going to say Basketball Hall of Fame. There was a little bit of a dust-up last week about their, moving the tournament to Boston, but they do great work, and they're a great attraction in Springfield.
Check out that reporting in the Springfield Republican. Aprell May Munford.
I want to give a shout out to Holyoke for helping place 70 families after those back-to-back fires. That's an amazing feat. And check out my story about one family who has rebuilt.
Yes, absolutely. Great coverage. I appreciate all of the work from the panel this morning, Aprell, Greg, and Eric. I'm Carrie Saldo. Have a great Friday, everybody. We'll see you next week at 9. Coming up today on The Rundown, our panel will unpack the effect the war in Iran is having here in the 413, from increased prices at the gas pump to reaction from Iranian students in the U.S., and how local legislators are reacting. And a state budget hearing at UMass discusses road repair funds, west-east rail, and many other issues with local impact we'll explore. Plus, plans to address healthcare needs throughout Western Mass. We're running down all that and more this week with our panel: Springfield Republican reporter Aprell May Munford, Greg Sukiennik, news editor for the Berkshire Eagle, and senior counsel for WilmerHale and former state senator Eric Lesser. Have something to say? Email therundown@nepm.org. Stay with us. The rundown of your need-to-know news from the 413 starts after this.